So I saw a recent patient with a very interesting case. This patient had had cataract surgery done in the mid-'80s, and she came in and she was wearing thick glasses, and she had actually had cataract surgery where they place implantable lenses after we take the cataract out, and that's a common practice that we do now. But she had one of the earlier lens models, and I thought to myself, I'm like, why does this patient have still thick glasses after cataract surgery years ago? And so she came in and said, is there anything else we can do to get further dependence away from the glasses that she had to wear? You know, most patients nowadays have cataract surgery and we either get them completely out of their glasses or certainly reduce their glasses prescription to a thin pair of glasses. This patient did not have that experience, had thick glasses. And so I worked with her, and it turns out she had, you know, back then they only had more or less one implant size, and often just put the same implant in the patient. It wasn't really custom fit, so they just had one size of implant, try to fit as many patients as possible with that one size. It was very common what was called a 19 diopter lens, which was used almost on everybody. And so today I actually had the ability to remove that lens and replace a new lens. So this was done years later, almost decades later, and it was interesting to see that on that lens was imprinted 19 diopters, so I knew it was that original lens. Back then they actually write the little number on the lens, so we knew what power it was. So this patient had a 19 diopter lens, when it turns out she only required about a 5 diopter lens. So we had about 14 units of prescription over-treated. So it's great to remove that high-powered 19 diopter lens, put a new low-power lens inside the eye to help get that patient the appropriate treatment that she required to now wear either no glasses or a very thin pair of glasses.